Welcome back, everyone. It's time for another deep dive.
Yeah.
And today, we're tackling something you deal with every single day in your practice.
Oh, yeah.
Sodium, potassium, and their effects on blood pressure and cardiovascular health.
It really is everywhere, isn't it?
It is.
Yeah.
Especially for our listeners, busy healthcare providers, residents who need those actionable takeaways
Right to the point.
for their patients. So to guide us today, we've got two great sources. First up, a systematic review with quite a title.
Yeah, it's a mouthful.
Community-level dietary intake of sodium-potassium and sodium-to-potassium ratio as a global public health problem. A systematic review and meta-analysis.
There you go.
And then a really interesting clinical trial.
This was a classic.
Effect of SART substitution on cardiovascular events and death.
Published in the NEJM back in 2021.
So much good stuff to unpack.
Yeah, I think we can pull out some really practical advice from these.
For sure. All right, so let's set the stage. This systematic review, it basically confirms what we already know. High sodium, low potassium diets are a global problem.
Yeah, it's not just a Western diet thing.
Right.
It's everywhere. And it's linked to, all the bad stuff, hypertension, cardiovascular disease, and even mortality.
Yeah. The study actually found some pretty big regional variations in urinary sodium-to-potassium ratio.
Oh, yeah. Huge differences. For instance, Asia had the highest ratios,
Wow.
while Australia had the lowest.
That is fascinating. What do you think is driving that? I mean, it makes you wonder, right? How do these global trends play out in our own patient populations?
Definitely something to think about. I mean, you've got to consider all the different backgrounds of the patients we see,
Right.
cultural dietary preferences, food availability, even socioeconomic factors. All those things play a role in sodium and potassium levels.
That's a good point. In a lot of places, processed foods, those are often the most affordable and accessible option.
Yeah,
And those tend to be loaded with sodium.
it's a good reminder for all of us. When we're talking to patients about cardiovascular risk, we can't forget about their individual dietary habits.
Absolutely. So true. All right, let's move on to sodium reduction.
Okay.
Now, there's been a lot of back and forth over the years about low sodium diets. Some are for it, some are against.
Yeah, the debate rages on.
What's the latest consensus? What does the research actually say?
Well, there's been some talk about a J-curve, that idea that there's actually an increased risk at very low sodium levels.
Right, I've heard about that.
But honestly, I think that's probably more about how we measure sodium than anything else.
Ah,
And when you look at well-designed studies that use accurate sodium measurements, the link between high sodium and bad outcomes is pretty consistent.
I see.
So for our listeners out there, the takeaway is this. For your patients with hypertension, reducing sodium consistently lowers blood pressure.
So it's a real thing.
It's a real thing.
That's good to know.
Yeah.
It's not all about lowering sodium, though, right? We've got to talk about potassium, too.
Oh, absolutely. Potassium is essential. Potassium. It's often overlooked, but it is crucial for regulating blood pressure.
I feel like potassium is kind of the unsung hero here,
I like that, the unsung hero.
It's doing all this good work behind the scenes.
And the evidence is strong. You look at studies like InterSalt,
Okay.
it shows that potassium intake, it's a strong predictor of blood pressure,
Regardless of sodium.
independent of sodium, completely on its own.
Wow. It makes you wonder how many of us are really emphasizing potassium-rich foods enough when we counsel patients.
Yeah. Are we giving it the same attention as sodium? Maybe not.
Good point. So we've got sodium reduction, we've got potassium. Is there a way to combine those benefits? Tackle both at the same time?
There is. Salt substitutes. That's the magic bullet.
Oh, interesting. Tell me more.
They allow us to reduce sodium and increase potassium simultaneously. It's like a 2-for-1 deal.
I like it.
And the SSS trial, the one from the NEJM, that really highlights the potential. They replaced regular salt with a substitute.
Okay.
It was 75% sodium chloride and 25% potassium chloride.
So they basically just swapped out some of the sodium for potassium.
Exactly. And the results were amazing. They saw significant reductions in stroke, major cardiovascular events, and even all-cause mortality.
Wow. That's incredible. What about adherence? Were people able to stick with it?
That's the best part. They had a 92% adherence rate over 5 years.
And 92% over 5 years.
I know, it's unheard of for any dietary intervention, let alone something as simple as changing your salt.
That's amazing. I bet some of our listeners are thinking about hyperkalemia, though.
Oh, yeah, of course. It's a valid concern.
Especially when we're talking about increasing potassium intake.
Right. But the evidence suggests that those fears about dietary potassium leading to hyperkalemia
Okay.
might be a bit overblown. especially for people without kidney issues.
So it comes down to careful patient selection.
Exactly. You've got to know your patients and tailor your recommendations accordingly.
Makes sense. Not a one-size-fits-all approach.
Absolutely not. It's about understanding the nuances of sodium and potassium
Right.
and how they affect each patient individually.
All right. So much good stuff to think about already. Let's do a quick recap. What are the key takeaways you want our listeners to walk away with so far?
Okay, big picture. We need to be thinking about both sides of the coin, sodium and potassium. It's not just about lowering sodium, it's about boosting potassium as well.
Finding that balance.
Exactly. We've seen some really compelling evidence for salt substitutes.
Yeah, for sure.
But we can't forget about individual assessment, especially when it comes to the risk of hyperkalemia.
So true. Before we jump into part 2, I want to throw this out there. We talked about how sodium to potassium ratios vary globally.
Right, different regions, different diets.
Exactly. Could this mean that regional dietary guidelines might actually be more effective than universal recommendations?
That's a really interesting thought. It gets to the heart of personalized medicine, doesn't it? Tailoring our advice to specific populations.
I think it's worth exploring for sure.
Absolutely.
All right, everyone, we're going to take a quick break,
Sounds good.
but stick around. When we come back, we'll continue our deep dive with even more practical tips and insights.
Can't wait.
And don't forget, you can find more information about the studies we've discussed in the episode description.
All the details are there.
We'll be right back.
It's amazing how much our understanding of sodium and potassium has changed.
I know, right?
Even just a few decades ago, it was all about sodium reduction.
Yeah, cut the salt.
Exactly. Avoid the salt shaker at all costs.
But now,
It's different. We're seeing a more balanced approach.
recognizing that potassium's important too.
It's not just about taking away the bad stuff.
Right.
It's about adding the good stuff too.
So how do we put this into practice? We know potassium-rich foods are key.
Yeah.
What are some good examples? What can we tell our patients to eat?
Oh, there are so many delicious options.
Légumes?
Fruits, like bananas, oranges, avocados, full of potassium, and vegetables. Leafy greens like spinach and kale,
Love those.
sweet potatoes, tomatoes.
So basically,
Eat your fruits and veggies.
the age-old advice.
It's classic for a reason.
True. It's backed by science.
And it's good for so many things.
Not just blood pressure.
Exactly.
But let's be real. Not all our patients are going to love the idea of overhauling their diets.
I hear you.
Some people just love their salty snacks.
You can't deny a good salty snack.
What's a good approach then? How do we make healthy eating sustainable?
Start small. Focus on gradual changes.
Baby steps.
Exactly. Maybe swap out one salty snack a day
Okay.
for a piece of fruit or a handful of nuts.
Little changes add up.
That's the idea. And remember, it's all about meeting patients where they're at.
Right. Some are ready to jump in head first.
Exactly.
Others need a gentler nudge.
Personalization is key.
So true. Now let's talk about monitoring. If we recommend salt substitutes,
Okay.
how closely should we be watching potassium levels?
It depends on the patient.
Of course.
Someone with healthy kidneys, no other risk factors for hyperkalemia.
Okay.
Routine monitoring might not be necessary.
And we could just check at their annual visit.
Exactly.
What about patients who are at higher risk, though?
Then closer monitoring is definitely a good idea.
Makes sense.
Check their potassium levels more often, maybe every few months, and be extra careful about recommending salt substitutes or potassium supplements.
It's a balancing act, isn't it?
It is. You're weighing the benefits of potassium against the potential risks.
Exactly. You know, something that really stood out to me in that NEJM trial,
Oh, yeah.
the salt substitute trial,
The SAS trial.
that adherence rate, 92% over 5 years. That's incredible.
It's amazing, isn't it?
What do you think made it so successful?
I think of a few things. First, the intervention was simple.
Just swap out the salt.
Exactly.
Yeah.
No crazy meal plans or calorie counting, just a simple touch.
Easy peasy.
And the researchers provided good support and education.
Oh, okay.
They made sure participants understood how to use the salt substitute
So important.
and why it mattered.
It makes a difference.
Plus, the study was done in a community setting,
Oh, interesting.
which I think fostered a sense of shared responsibility.
Like they were all in it together.
Exactly.
So a simple intervention, ongoing support, and a supportive environment.
That's the recipe for success.
Powerful stuff. Now let's shift gears a bit
Okay.
and talk about the food industry.
Oh yeah, big player.
They have such a huge influence on what we eat.
They control so much of the sodium and potassium in our food.
Exactly.
Yeah.
So what role do they play in all of this?
Well, I think they have a responsibility to make healthier options more available.
Right. And affordable.
Absolutely. We need to see less processed food
Yeah, all that sodium.
and more fresh produce.
Make it accessible.
And affordable.
That's key.
So important.
It's about creating a food environment
Yes.
that supports healthy choices.
Exactly. And consumers have power here too.
Oh, yeah.
We can demand healthier options.
With our wallets.
Exactly. The more people ask for it, the more likely the food industry is to respond.
It's about pushing for policies that promote healthy eating too.
It's a system-wide effort.
We need to work together to make it easier for everyone to make healthy choices.
Absolutely.
Now, let's be realistic. Fresh produce can be expensive.
It's true.
How do we help patients who are struggling to afford a healthy diet?
There are resources out there.
Okay.
Community gardens, food banks.
Those are great.
And we can give patients tips on stretching their food budget.
Like what?
Buying frozen fruits and veggies. They're often cheaper.
That's a good one.
It's about understanding the challenges our patients face and offering practical solutions.
Compassionate care.
Exactly.
Okay, so we've talked about individual patients and the food industry.
Right.
What about public health initiatives? What's happening on a larger scale?
There are some exciting things happening globally.
Like what?
The World Health Organization,
The WHO.
they've set a target for a 30% reduction in global sodium intake
Wow, 30%.
by 2025.
That's ambitious.
It is,
Yeah.
but it's necessary.
I mean, high sodium intake.
It's a major contributor to cardiovascular disease worldwide.
No doubt. How are they planning to achieve that?
Multi-pronged approach.
Lay it on me.
One strategy is food labeling.
Clear labels.
Exactly. Help consumers make informed choices.
Transparency is key.
It empowers people.
Another strategy, working with the food industry to reduce sodium in processed foods.
Reformulating recipes, setting voluntary sodium reduction targets.
We've seen some progress there,
Yeah,
but there's still a long way to go.
definitely.
And of course, public awareness campaigns.
So important.
Educate people about sodium and potassium,
Sometimes a little humor can help get the message across.
for sure. All right, so the WHO is doing their part.
Mm-hmm.
What about individual countries? Any shining examples of successful sodium reduction programs?
The UK has made some great strides.
Oh, right.
They've got a combination of things.
Like what?
Voluntary sodium reduction targets for the food industry,
Okay.
public awareness campaigns,
Mhm.
and even a salt tax.
A salt tax.
Yeah.
Tell me more.
It's a small tax added to foods
Okay.
that are high in sodium.
Ah, interesting.
The idea is to encourage food manufacturers to lower the sodium content.
So it's like a financial incentive to make healthier products.
Exactly.
And is it working?
It seems to be. The UK has seen a significant decrease in sodium intake
Wow.
and a corresponding decline in blood pressure and cardiovascular disease.
That's what we like to hear.
It shows that these initiatives can actually make a difference.
It's proof that we can move the needle on this issue.
With a combination of individual effort and systemic change.
All right. So much good stuff to unpack. Let's bring it all together. What are your top 3 takeaways for our listeners?
Number 1, sodium and potassium, both essential nutrients. They play a critical role in regulating blood pressure.
It's all about balance.
Exactly. Number 2, high sodium intake, low potassium intake.
Bad guys.
There are major risk factors for hypertension and cardiovascular disease.
The things we want to help our patients avoid.
Absolutely. And number 3, we can make a real difference in our patients' lives
How?
by addressing both sodium and potassium in our counseling.
So important.
It's about empowering our patients to take control of their health.
Those are fantastic takeaways.
I hope so.
They really highlight how important it is to stay up to date on the research
Yeah.
and translate that knowledge into practical advice for our patients.
We need to be lifelong learners
Always learning, always growing.
and advocates for our patients.
Well, this brings us to the end of part 2 of our deep dive.
Time flies.
But don't worry, we've got one more part coming up.
Can't wait.
After a quick break, we'll wrap things up and offer some final thoughts on how you can apply all these insights to your practice.
Looking forward to it.
And remember, you can find more information about all the studies we discussed and some additional resources in the episode description.
It's all there.
We'll be right back.
And we are back for the final part of our deep dive into sodium, potassium, and your patient's health.
It's been a great discussion so far.
It has. We've covered global trends, individual patient management,
Lots of good stuff.
so much. But now I want to focus on you,
Okay.
you, the clinicians. What can you do to make a real difference in your practice?
I'm happy to share some tips. Perfect.
Yeah.
Let's start with patient communication. How do we talk to patients about sodium and potassium?
Yeah. How to make it resonate?
Exactly.
It's about making it relatable, connecting it to their lives.
So instead of
Bombarding them with jargon
Right.
or generic advice,
Mhm.
we try to link these concepts to their personal health goals.
So for example, if a patient's worried about blood pressure,
Right.
we can explain how reducing sodium and increasing potassium can help with it.
Exactly. You can even use visuals,
Oh, like what?
food charts, infographics,
Okay.
to show the sodium and potassium content of different foods.
That's smart.
Yeah.
And don't forget to involve patients in the decision-making.
So important.
Ask them about their diet, their preferences, their challenges.
Empower them to be active participants in their own health.
I love that.
Yeah.
Now, when it comes to making dietary changes,
Right.
remember baby steps.
Small steps, big results.
Encourage patients to start with 1 or 2 manageable changes.
Like swapping a salty snack for a piece of fruit.
Or adding some leafy greens to their dinner.
Exactly. Those little things add up.
And what about salt substitutes?
Those can be game changers, for sure.
But we've got to be mindful
Patient selection.
of course,
Mm.
especially for patients at risk of hyperkalemia.
Close monitoring is key.
Always.
Yeah.
What about resources? Are there tools we can give patients to support them?
There are tons of great resources out there.
Like what?
Many hospitals and health organizations, they have patient education materials
Okay.
on healthy eating, sodium reduction, potassium-rich foods.
Perfect. And reputable websites.
Yeah, the American Heart Association, the National Kidney Foundation.
Great resources.
Uh,
And don't forget about simple things.
like what?
Grocery lists, recipe ideas,
Oh yeah, those are super helpful.
featuring potassium-rich foods, of course.
Exactly. Practical ways to make those changes.
And for patients who need more support,
Right.
refer them to a registered dietitian.
They can provide personalized guidance.
Okay, one last thing I want to touch on. We talked about regional dietary guidelines.
Oh yeah, that was a fascinating thought.
Do you think those could be more effective than universal recommendations?
Potentially, I think it makes sense to tailor guidelines
Right.
to different regions.
Different cultures,
Different.
diets.
Exactly. One size doesn't fit all when it comes to nutrition.
Well, this has been an incredible deep dive.
I've enjoyed it.
So much good information about sodium and potassium
From research to practical tips,
and public health implications.
it's all connected.
One final question for you before we wrap up. Based on everything we've learned today,
Yeah.
would you recommend a 75% sodium chloride, 25% potassium chloride salt substitute to your patients?
For many patients, I think so. Especially those with hypertension and no contraindications.
Okay.
It's a simple change with the potential for big impact, but of course, individual assessment is crucial.
Always. So much great advice for our listeners to take away.
I hope it's helpful.
Thanks for joining us for this deep dive into sodium, potassium, and your patient's health.
Yeah.
We hope you found it informative and helpful.
It's been a pleasure.
Remember, you can find links to all the studies we discussed and additional resources in the episode description. Until next time.